Hi, I'm Christine Castater. I'm one of the trauma and acute care surgeons at Wellstar Kennestone Hospital in Marietta, Georgia. So this is a 36-year-old male who really had no past medical history. He shot himself in the face. He had a full thickness, it was basically in his mouth and it came out of his left cheek. He had a full thickness wound with an injury to the parotid gland that had a parotid fistula. The size of the wound wasn't very big, but the problem was that we had a very hard time managing the wound because of the parotid saliva fistula that was happening. It was about 4 by 2 by 2. So initially he had to go to the operating room. He had a lot of bleeding. He had embolization of his facial artery. And he had some, some of the parotid, they tried to kind of embolize to see if it would stop the parotid leak. He was admitted to the hospital and we continued with local wound care. And so then we decided we would try to use Myriad Morcells on it. We applied them on day 7 with sterile saline at the bedside. And then we placed a secondary dressing with zero form and just 4x4s and tape. His pain was really well controlled. You can see on day 3 that the wound is actually really starting to granulate, and also the morcells are starting to really integrate into the wound. So by day 7, the morcells are very well adhered. We've got like 80% integration, and you can see that there's a significant amount of granulation tissue. Also, the depth of the wound, which is a little bit hard to see in these pictures, that it was much deeper and had some tunneling. And you can kind of see in this picture that the depth is really starting to rise because of the increased granulation tissue. So at this point, you can see the morcells are like 90% integrated. The entire wound has contracted. It's much smaller, and the granulation tissue is filling the depth of the wound. It's essentially filling from the inside out. On week 4 follow-up, you can see that he's got epithelialization of his skin over the wound. He started to actually grow some facial hair over it. He's had, basically a great result. The parotid gland fistula was completely resolved, and he had, just a great result as well as a cosmetic result. This is a week 6 follow-up. Essentially, you would probably never even know how bad of a wound that he actually had. His parotid fistula was completely resolved. He didn't have any other further surgical interventions. So here is kind of the progression of the wound, because sometimes when you click through them one at a time, it's a little bit hard to see, but when you see them all next to each other, you can really say, oh my goodness. So the one on the left is the initial wound. It really tracks on that picture. You can kind of see what I was talking about to the left of the wound. So kind of like medial of the patient's face, it really tracked into the cheek. And that makes sense because he shot himself from the inside of his mouth. And then you can see as it progresses along to even at 10 days, you can see an amazing amount of granulation tissue. And then at the end, he had, a really, really amazing result.